Good afternoon, doctors. We are now at the session 5 of RRR. And by now, you would have watched the session 1 where we discussed about the war strategy and 80-20 principle. Then in the session 2, we discussed on smart reading and revision techniques. And in session 3, we moved on with managing fear, anxiety, and burnout. Then last session on Christmas, we discussed about how to think like an examiner, essays, short notes, and MCQs, how to go forward with it. And today, we are going to go further one step ahead. Already we had started our schedule and it has been around 2 weeks, 5 days in your medicine, 5 days in your surgery, and 3 days in your obstetrics, almost 13 days, 2 weeks. And today, what we are going to do is something that every student miss out, every mentor miss out, or every mentor avoid to talk about. What is that? Talking about the failure. We are going to talk today about the failure, not motivationally, but practically. By now, some of you would have noticed, if you are following the timetable, if you are following the schedule, some of you would have noticed, sir, I can write the heart failure essay perfectly, but shock is still confusing me, sir. Some essays are very easy for me, some essays are very difficult, sir. I am scoring 60% in my internal assessment, but not 70%, sir. I expect 70%, but I am not getting it. My expectation is far ahead, but what I get is very, very low. And I am blank on some topic even after reading twice, thrice. And the entire subject, dermatology, psychiatry, orthopedics, are still left out, sir. I feel stressed away. I feel like I am lost already. How many of you, can you put it in the chat box? Can you put it in the chat box? How many of you by now feeling that you're already lost? You're already cannot fulfill the plan. You're already failing in whatever you're planning. How many of you are thinking like that? Come on, put it in the chat box. I think I'm getting some questions. Sir, how to pass in the final year MBBS, 9 paper clearing, timetable schedule for final year exam. Yeah, that's exactly what I'm doing every day, my dear. If you are attending my session, now can you tell me, guys, can you put it in the chat box? How many of you are feeling lost by now? I want all of you to be interactive. This is not a session where we are reading something. This is a session where we are feeling. We are just understanding where we are standing. Only when we know where we are standing, we will be able to navigate further. Yes, very good. Very good. Some of you are putting it. Yes, sir. Yeah. So many of you by now will be feeling that you have lost somewhere. You have lost somewhere. This is not weakness. This is a data. And the data, what we are doing is going to navigate us towards winning. Today, what you are going to exactly learn is how to identify your real weakness or real weak areas, not just the perceived ones, and how to measure in depth on each weak areas to know what salvaging looks like, and how to build a personalized damage control plan. Because you will think by now, sir, you are giving a general timetable. I'm already strong in obstetrics, and you're asking me to spend 5 days for obstetrics. I am not at all satisfied with my medicine, but you are just giving me again 5 days only. Sir, what to do? By the end of the session, you have a customized strategy for each weak area, and you will sleep better today because you will start pretending to be like stronger where you are actually weak. Okay, so that's exactly what we are going to do today. First, let's kill the myth. A weak area is not a subject you haven't studied. Most of you think like that, sir, I haven't touched dermatology yet. I haven't touched orthopedics yet. So that is my weak area. Sir, I have read for 10 days medicine. Then it becomes a strong area. How many of you feel like that? Before that, can you put it in the chat box? Can you guys put it in the chat box? Which is your weak area? Let me ask Varsha and other people, those who are here. Can you tell me, can you put it in the chat box? What is your weak area? Leave others. Leave everyone's idea. It may be a very easy subject for others, but it may be difficult for you. Can you put it in the chat box? Which is your weak area? Let me see who is going to come on, tell them, tell it in the chat box. I want it to be interactive. So, which is your weak area? Can you put it in the chat box? Which is your weak area? Some of you may tell dermatology, some of you may tell medicine, some of you may tell surgery, some of you may tell obstetrics. Everyone have different weak areas, isn't it? Yes. So, according to me, how I keep is, before moving. So last session, how many of you started following it before moving into the weakness? Before talking about weakness, meanwhile, put it in the chat box, which is your weakness. Medicine, Varsha is telling medicine. And one little star is telling many topics are forgotten star. Aravindan is telling medicine. Yes. Before moving to that, Aravindan, Varsha, and others, can you put it in the chat box? Another one question, one more question. How many of you followed the 7-point structure, 30-second short note, and MCQ pattern, which I have discussed in the last session? Did you follow it? And what was the result? Did you feel somewhat improved when you follow this technique? Can I put it in the chat box? Yes, many of you would have bought some changes. I don't expect full changes when you are going to start with it. Some changes everyone must have followed or must have had when you followed the session 4 techniques, whatever I have discussed. So today, honest assessment. I am studying, but I am blanked out. That's what Aravindan is telling. That's what Little Star is telling, isn't it? I can write a question, but the other question is confusing me. I am stuck in 60%. Isn't it? That's what you have told. So, what is a weak area? That's where I started, isn't it? What is a weak area? You read a topic, you read a topic, and you are not able to understand it. Is it a weak area? No. What is a weak area? Weak area is a topic where your performance is significantly low compared to other topics, even after studying. That's what some of you have told, right? Many topics are getting forgotten, taking too much time to complete a single topic. Why do you have this difficulty? Because these are your weak area. So, what we are going to do is we are going to make this weak area into 4 levels. We will divide this weak areas into 4 levels. Today, what you are going to do? After the end of the session, divide your entire weak subjects into 4 levels. Not all weaknesses are equal, isn't it? You may feel surgery, obstetrics, medicine, all you're weak. But everything is not at the same level, isn't it? So how you are going to divide it? How you are going to divide it? So I'm going to divide it into 4 levels of weakness. Number 1 is a conceptual block. You read the topic, but the concept doesn't click. For example, shock, types of shock, mechanism of shock, physiology of shock, everything you read, but it feels abstract. Renal failure, electrolyte shift, acid-base balance, all these are confusing you. Genetic disorders and inheritance pattern, you have read, but it is getting forgotten. You read, you understand, but if I am going to ask you, explain cardiogenic shock, it's going blank. Isn't it? So you have read shock for around 1 hour in your timetable. But now when I ask you define cardiogenic shock or explain cardiogenic shock, you are not able to tell. That is going to be the level 1. At the conceptual itself, you are not understanding. So now, till today, medicine, surgery, obstetrics off is over as per our timetable or whatever timetable you are following. So whatever you have learned till today, just take back those topics. Ask yourself whether you are able to tell at least 10 points in that particular topic. If you are not able to tell 10 points in that particular topic, whatever you are read already, that means your weakness is at conceptual level. Clear? Next comes the knowledge gap. You understood the concept, but you are missing the fact. For example, you know tuberculosis management, but you don't know exact drugs dose. Okay. HRZE drug you know, but what are the dosage of individual HRZE drugs? You know heart failure, but you are unclear about the New York Heart Association classification details. You know pneumonia, but you are not sure about the CURB 65 scoring system. That means you can explain something vaguely. But when I ask you exact number, criteria, facts, you are forgetting. That is going to be a knowledge level weakness. So first is going to be conceptual weakness. Second is a knowledge level weakness. Okay, then comes the memory decay. I think this is where many of you get wrong. So I think you have messaged me, right? So I think Varsha as well as Little Star, both of you messaged in the group. Both of you put in the chat box. What did you guys put in the chat box? Sir, I read. I was able to recall that time. I was able to recall yesterday. But after I shifted to a new subject, now my memory is blank. I'm forgetting over the time. You studied cardiology perfectly 4 weeks ago. Now it is week 6. And now you are maintained with the 2-minute drill. You are only maintained it with 2-minute drill. When you try a full essay, you are missing 40% of the answers. 60% I am able to recollect, but 40% I am not able to recollect. Something is going out of my mind. You feel confident, but when you sit and write, material is missing. Knowledge is missing. That means it is a memory decay. That is the third level of weakness. And fourth level of weakness is what everyone will get: exam anxiety weakness, where you know the topic, you are very confident about it. But when I'm going to put a pressure on you, your mind freezes. You can answer heart failure perfectly at 10 p.m. in your room. But when I'm going to conduct a mock exam, I told you, right, every week, try to take a paper, try to take a essay question, write down. That time when you are not able to write it, that means your performance in the timed exam is 30 to 40% less than the home practice. So normal time when you practice, you are able to recall. But the same thing, when I am going to ask you to answer at a timed zone, at an exam pressure, you are not able to do it. That means it is because of your anxiety. Now tell me, at what level of weakness you are for medicine? Whoever there in the session. Okay, medicine. When I'm going to tell you medicine, at what level of weakness you guys are there in the medicine? At what level of weakness you guys are there for medicine? Can you put it in the chat box? At what level you guys are there in medicine subject? Whether it is in the conceptual level, knowledge level, DK level, anxiety level. But even though I'm asking you, it's good you are not posting it, because medicine is a old subject. We shouldn't look into like that. Cardiology, whether you are conceptually fine. In the cardiology, must to know topper's place. Both. Individually look into this. Now take out your schedule, whatever I have shared. Question bank, whatever I have shared. In that, individual questions. See, heart failure. Whether I am in the conceptual failure, knowledge failure, or in the memory decay, or in the anxiety. Individually look into it, where you are standing. Write down where you are standing. Now I will give you the solution. Now what I'm going to do? I'm going to give you a solution. So for all this four, I'm going to give you how to overcome that. Now I'm going to talk about how to overcome that. Okay. So how we are going to overcome? For example, if it is going to be a level 1 conceptual block, what you need to know is you need to look on the explanation. So first thing is you need to know the explanation. Then you need to visualize. If you are getting blocked in the conceptual level, read the explanation, visualize in your mind, and always use analogy. Always compare, always bring an example into your reading. Don't go by your book. What you have seen in your ward, what you have heard from the news, what you have heard from different people, myocardial infarction, relate it with someone, then you will never forget. Then comes the knowledge gap. When your failure or weakness is in the knowledge gap level, then what you need is a targeted fact learning, not completely reading from first page to last page. That is not going to work for you. Reading concept is not going to work for you because you're already thorough with the concept. What you need to know is you need to take down. I told you, right, in a A4 sheet, write down. Write down the skeleton. I told you last time itself. If you're going to talk about heart failure, write down the skeleton. So that skeleton, you need to improvise. You need to go directly towards the facts where you're missing. Targeted fact learning. And if you're in this stage, then probably mnemonics will be helping you. So you can use mnemonics only in the knowledge gap level. If you are not strong in the concept, then don't use mnemonics. If you are not strong in the knowledge gap, there is a gap, then you use mnemonics. And third one is going to be your DK. If it is going to be DK, that means there's a maintenance failure. That means you need a spaced revision. You need a spaced revision, and you need a active recall drill. I already talked about this active recall drill, isn't it? So you're going to do a spaced revision and you are going to have an active recall drill you're going to do. And if it is at the level of exam anxiety, always I will tell this, when you are fearful about something, do it repeatedly. In Tamil, you have this proverb, isn't it? Palaga palaga, everything will become easier. We will be telling, isn't it? Whenever you practice, it becomes perfect. Practice makes a man perfect. That way, what you need to do is you need to have a repeated timed practice. Okay, so you need to do repeated timed practice. Okay, under stimulated pressure. Under a stimulated pressure, you need to do. So if you treat level 1 like level 3, you will be wasting your time. You will be wasting your time. You will always remain weak. So once you understand at what level of weakness individually each question is, then it is going to become easy. First time when you study, you will have a level 1 of weakness. Shifted to level 4 of weakness. All the questions must be shifted to level 4 of weakness. Level 4 of weakness, repeated practice, it is going to give you, it is going to benefit you. That's all. This is how you are going to identify. Then coming towards how to identify your real weak areas. The diagnostic protocol I am going to give you today. Stop guessing. Stop guessing. Sir, I may be weak in medicine. I may be weak in surgery. I may be weak in pediatrics. Don't give this maybe. Instead of giving maybe, okay, instead of guessing, what you're going to do is you are going to use this protocol. So what I am telling you is you have RRR timetable with you. Okay, if you have already completed general medicine, okay, if you have completed general medicine, 5 days properly, all the must to know topic if you have covered. Okay, or example, if you have completed gynecology, if you have completed surgery, take the surgery. At least 50% of your syllabus if you have covered. So, at least 50% of your syllabus if you have covered. What I will be doing from now on is, I am also going to send you question paper. Okay, I am going to send you mock question paper from now on. So mock question paper from tomorrow, I'll be sending you. First, I will start with medicine, then surgery, then OG, then pediatrics. In this order, I'll be sending you mock question paper. What you're going to do is allot just half an hour to 1 hour a day. Okay, take essay 20 minutes. Okay, for essay, take 20 minutes. For short notes, take just 5 minutes. Okay, take 5 minutes. Strict timer. You're going to use a strict timer. You're going to use strictly the timer and you're going to write it down. And then I will share you the answer key of that particular question paper. What I will be doing? I'll be sharing you an answer key of particular question paper. Now, what you are going to do is write down whatever you know. 20 minutes take for essay. Short notes, 5 minutes each. How many essays, how many short notes you are able to write in a day? Don't worry. If you are reading obstetrics today, take medicine, whatever you have completed. In between, you will have this free time, isn't it? Or you feel bored of reading obstetrics. You are feeling bored of reading that particular topic, that particular subject on that day. Then take that gap and try to write the essays out of your memory. You are not going to write it down by seeing book or by you are not going to write it down with the aim to get full score. Nothing. You're just going to test yourself how you are prepared, how you are prepared in the previous days. So write down. Once you write it down, I will be sending you the answer key. Check with that. Score yourself. What you're going to do? Score yourself. So now I'm going to score and calculate the grade. For example, let's look like this. So essay, short notes, MCQs. So I'm going to give you in general surgery itself. I will make it into part 1, part 2 or GIT medicine or urology in surgery, neurosurgery. Like this, I'll give you separately block wise. And what you're going to do is you're going to write down. You're going to write down essay out of 10 marks or out of 15 marks. How much score you got? Short notes. How out of 5 marks? How much score you got? MCQs. Out of 10 MCQ, how many MCQ you got? Okay. So when you do this, then you see which area in surgery. General surgery, are you strong or weak? GIT, are you strong or weak? Urology, are you strong or weak? Neurosurgery, are you strong or weak? So likewise, put it as a schedule, put it like this. Then see at which point you are weak, at which point you are going to be weak. Once you identify the point where you are weak, okay, you can tell. I'm not going to tell that surgery is weaker for me. What I'm going to tell is, sir, GIT I am weak, sir. Neurosurgery I am weak, sir. I am going to have a specific thing, isn't it? That time I will have a specific topic. I will have a specific topic. So first, score it. Okay, then subject wise you score it. Okay, so first subject wise we will be going. One subject wise we go, then we will go with individual subject. We will be pondering into depth. If you are able to answer 90%, grade it as A. That means you are strong. If you are scoring 75 to 90%, grade it as okay, but minor gaps are there. You will concentrate in that. 60 to 75% only you are able to answer. You are weak. You need to work on it. And if it is going to be less than 60, then damage control is needed. Then damage control is needed. Then you need to control the damage. How you are going to control the damage? By drilling down the individual subjects like this. See where exactly you are weak. For example, if I am weak in the GIT and neurosurgery, I am going to concentrate on them and I am going to diagnose. Now I have diagnosed where I am weak. Now for each weak area, for example, GIT and neurosurgery, if I am weak, what I am going to see is where I am lagging, whether in the conceptual, whether in the factual, whether it is going to be a memory decay, whether it's going to be anxiety. At the 4 levels, in which level you are. For example, in GIT, you are not able to write the essay. You wrote scattered point, no clear structure, complication of perforation, all these things you left. So likely in that case, it may be a conceptual block and knowledge gap. For example, short notes. Short notes in pulmonology, you missed out lights criteria. But some minor criteria you wrote, but major criteria, 1 or 2 you forgot. That means there is a knowledge gap which is present. That means you are in the level 2. MCQs, only 3 out of 10 you have scored. That means random guessing you have done. So either concept there is going to be a confusion or you are in the exam panic. Understand where you are lagging. So understand where you are lagging. If it is going to be level 1, if it is going to be a level 1, what you are going to do? For that, you need to identify the weak areas. If it is going to be level 1, that means the concept doesn't click no matter how many times you read. That means there is a problem in understanding. Then you watch video. Many people are asking me, sir, I'm having various apps. I don't know which topic I need to see video, which topic I just want to go through the notes, which topic I don't want to touch into all those apps. When you have a conceptual lag, that means you need to understand. You need to understand with analogy. You need to understand the diagram. You need to teach back. For example, let me tell you, shock. Understanding shock. Shock is confusing because it's abstract. Low pressure, low perfusion pressure leading to cellular ischemia. So how you are going to understand it? So understand it like a city water distribution system. Normally, pump is working well. Water is reaching all the houses with good pressure. Now, if your city motor is not functioning, from the Chambrambakam lake or from Pulal lake, your water is not reaching your city properly, the distribution center motor is not working. That means your pump is failing. That means water reaches house. It reaches with the pressure of water, it reaches various house. But the motor is not working. That means only it reaches at a low pressure. Some distant areas don't get the water at all. So when these distant areas are not getting water, the houses over there will be suffering. Same way, your heart is going to pump the blood, but that pumping is not efficient. If the pumping is not efficient, it is not reaching the other areas or the farther areas. When it is not reaching your extremities, the tissue death will happen. So when your cardiac output is nothing but your heart rate and your SV. So adequate blood pressure should be there. Only then all the tissues will be perfused. For example, if cardiac output is less or when the vascular resistance is less, that means your BP will be low, tissue perforation will be low, and it leads to cellular death. So here what I did, I have not memorized the definitions. I am visualizing the mechanics by using some analogies. So water pump, traffic jam, electrical grid, likewise. And then I'm going to write it as a flow chart instead of a text. And I'm going to break it down into small pieces and understand it. So if you don't have your friends for doing a group study, take a mirror. In front of mirror, try to recite whatever you have learned. Explain it to the mirror. You don't need to write notes. You can just explain to the mirror. Probably the other person, the inner conscience inside you may learn an answer and probably it may enter into the subconscious level also. Okay. Now, level 2. So now what happened? First, I have understand the analogy. Then I am writing it down. For example, normal. If it is a normal heart, it is going to affect the BP. It is going to give you the perfusion pressure. Perfusion pressure. So shock, what happens? There is going to be a less BP. Because of that, there is going to be hypoperfusion. Because of hypoperfusion, there is going to be a organ failure. So you need to understand this. Now teach it back to a friend, phone recording, mirror. You're going to do this. Do it immediately when you identify the block, not after weeks. Then comes a level 2, knowledge gap. So you understand the concept, but you are missing specific fact, number, criteria. What you are going to do? What you are going to do in this case? So you are going to understand that now you have a factual problem. So how to understand these facts? How to remember these facts? Targeted fact harvesting. What you're going to do? You're going to target the fact with, or you're going to use mnemonics. You're going to use mnemonics. In this condition, you're going to use mnemonics. Okay, for example, in the mock exam, whatever you have attended, to yourself, not to others, to yourself. What is a specific fact that I missed? For example, curve 65 for pneumonia, I have missed. Now you know what is CURB, confusion, urea levels, respiratory rate, BP, age is 65. But you missed the exact cutoff. You remember this confusion, urea, respiratory rate, BP, 65 age. This you are remembering. But you missed out urea above what it is elevated. Above 7. Above 7 millimole per liter. If it is there, it is going to be elevated. You remembered elevated urea level, but you missed out what exact value. You remembered high respiratory rate, but you missed out if it is more than 30 per minute. You know low BP, but you missed out what is a cutoff. Okay, if you missed out what is a cutoff. And you might sometime miss the interpretation. Misinterpretation. So when it is going to be 0 to 1, you have to treat by OPD. If it is going to be 2, then you need to admit the patient. If it is going to be more than or equal to 3, you need to admit in ICU. Okay, once you miss out this, now what you need to do? You need to prepare a mnemonic or a table and stick it out. Confusion, 1 point. Urea more than 7, 1 point. Respiratory rate more than 30, 1 point. BP less than 90, 60, 1 point. Age more than 65, 1 point. 0 to 1 now home, more than 2 now hospital, 3 plus now ICU. Then what you're going to do? Next day morning, wake up, close the book. Now write the curve 65 from your memory. If you get all the details, move on. If you miss even one detail, again do it tomorrow. Until you get successful, you are going to repeatedly do this. You are going to repeatedly do this. Clear? So this is exactly about the knowledge gap. Batch these. Do all the knowledge gap in one fact consolidation session. That's why I told you, always have a day or 20 minutes in a day for concentrating on what all the criteria you have learned so far. What are the list you have learned so far. Everything, consolidate them, group them, and every day take 20 minutes to revise the whatever things you have learned in the previous days. Okay, then comes the level 3, memory decay. So for memory decay, the problem which you have told is you are remembering, you are studying everything, but over time it is fading. Only after a light revision session, I am getting it. Only after a light revision session, I am getting it. So when you have this as your problem, what you're going to do is your solution is a spaced recall. So what you need to do? Spaced recall and full essay practice has to be done. Full essay practice has to be done. For example, from mock exam, I wrote heart failure essay 4 weeks ago perfectly. But today I'm forgetting the management of the drugs and the complication. Those things are forgetting. That means it's a memory decay. The concept is still there. You know what it is. You're confident, but you're not able to get out the fact. So now what you're going to do is you're going to do an aggressive spaced recall. For this topic, just to do 2-minute drill. If you are confident also, first day, full essay, 20 minutes timer, you just try to tell it. Third day, again, write down the full essay again. And fifth day, write again the full essay again. Or skeleton. And day 7, short notes, only 2 minutes. So when you're going to do like this is a forced retrieval at a spaced interval. Your brain will be learning. This is important. Keep it fresh. Keep it fresh. This is going to appear in the exam. Your brain is reminded again and again. Your brain will be like highly functional that when you see this question in your exam, immediately you will start answering it without even a single minute of thinking. Okay, single minute of thinking. And after 1 week of aggressive recall, go back to 2 minute drill. After aggressive recall, then again go back to 2 minutes drill. Every day, 2 minutes, try to revise it. Okay, so now the topic is re-imprinted. So 20 minutes into 3 times in the 1 week you have done. That means more than 75% your brain will be remembering it. More than 75% your brain will be remembering it. So when you don't have understand or when you score less than 75% or essay, only 6 marks I am getting or 7 marks I am getting out of 10, do this again and again. That will help you guys. Now coming to the level 4, this is most of you, including me, have before the exam. We will all be confident, but we will forget things. We will forget things at the exam time. When you sit in the exam, you tend to forget what you're going to do. What you're going to do when you forget this. So this is what we are going to learn today. That is going to be, you know the topic at home, but when you write exam or timed exam under the pressure, your mind is going to be freezing. For this, what you need to do is, you need to do a timed practice. That is what is needed. And along with that, anxiety has to be reduced. Anxiety inoculation has to be done. What you're going to do? Step 1, practice under real exam condition. Real exam condition means real. Sit with a timer. Strict. No extension. Phone has to be placed in the other room. No distractions. Sit at a desk, not in the bed. Don't be in your comfortable position. Come out of that comfort zone. Mark as soon as the time is ending. You're going to give up. You're going to leave your paper. You're not going to review or change after that. Feel that pressure. If you want that pressure, ask your mother, ask your brother, ask your sister, whoever at home to give you that pressure, that environment. Only then you will learn. Only then you will learn what is the problem with you. Then step 2. After the step 1, what you're going to do next? Step 2. Step 2 is you are going to do this repeatedly for the week topics. For example, GIT la essay. Week 1, 2 GIT essays under timed condition. Again, week 2, you're going to do another 2 more. Week 3, you're going to do 2 more. By the week 3, your brain stops panicking because it becomes familiar to you. Okay, because it becomes familiar to you. Okay, so untimed when you're going to keep, it is going, you may get 9 out of 10. But when it is timed, you get only 5 out of 10. 4 points is going to reduce. Why? Because of high anxiety. This gap is there, right? This gap is going to slowly reduce when you practice more. Okay, start this now for any topic where more than 2 point untimed time gap is there. So untimed when you're going to write an exam, how much mark you get. When you are going to put a pressure, how much mark you're getting. See the difference. That has to slowly, gradually reduce. Okay, now, let me give you a template to fill in your own damage control plan. You're going to fill it on your own. I'm not going to fill it. Okay, I'm not going to fill it. It's going to be your own. You're going to try to control your own damage. Let me give you a template now. For example, let me tell you, this is going to be your week 1. Okay, so take a fresh page. I want you guys, those who are seeing now, take a fresh page. Okay, take a fresh page, write it along with me. Take a fresh page, write it along with me. That is why I haven't put a slide for this. That's why I haven't put a slide for this. You're going to write along with me what you're going to write. So first one, week. So let's example, this is your week 1. Okay, so now tell me which is your weak area. So for example, weak area 1. So example, GIT surgery is my weak area. Now, level of confidence. So level of failure, whether it is going to be 1, 2, 3 or 4. Let me choose 2 as my level of area. How do you tell? What is the evidence? Write it down. Now, apply the fixation. How you are going to fix it? Level 1. If it is going to be level 1, I am going to find an analogy to it. I am going to see the diagram, flow charts and visuals. And I am going to teach it back. I am going to teach it back. Okay, I am going to teach it back. Whether did it? If you are done, tick mark. Okay, then coming to your level 2. Level 2, fact harvest. So what you need to do? You need to harvest your fact. And you're going to talk about the mnemonics. Okay, so every 15 minutes, every day for 15 minutes, I am going to spend with this. This is going to be for 20 minutes and this is going to be for 15 minutes. If it is going to be level 3, so spaced recall. What I am going to do? Spaced recall. So for 7 days continuously, overall, I am going to take 60 minutes. Every day, just 10 minutes per day, I am going to give a spaced recall. Every day, one essay I am going to recall. If it is going to be level 4, I am not going to recall. I am not going to waste my time in reading again. What I am going to do? I am going to do a timed practice. I am going to do a timed practice. So first, find which level you are lagging. Then apply this fix. Now we will keep a target. We will keep a target. Next mock score. When I am going to do a next mock, I am going to score how much? More than 75%. So my target is more than 75%. And what is the timeline I am going to keep? So when I am going to keep a timeline, more than 75% when I will get, by which date? You are going to do like this. This is for weak area 1. Same way, weak area 2. Okay, write down weak area 2. Same way, follow the same thing. Okay, what is my weak area 2? Weak area 3. Likewise, you're going to answer. Likewise, you're going to put. Okay, once you do this, for example, my weak area is shock. In general medicine, shock is my weak area. What is my level of understanding lagging? Conceptually, I'm lagging. Then what is my evidence? I got only 3 out of 10 in my essay. I was not able to explain the cardiogenic versus septic shock. I get panic when I'm going to see a essay or short note from this particular topic. Then what you're going to do? You're going to apply level 1. What is a level 1? Analogy, diagram, normal versus shock. Pump anamol analogy you're going to do, and you're going to teach it back to your friend. And by 2 days you have completed. Then again try answering. My target is in the next mock, I have to get more than 70%. So you keep a timeline. By December 31, I will complete this weak area shock. Okay. Then coming to your weak area 2, let's say curve 65 is your weak area. You're not remembering it. So you are remembering the concept, but you're not able to remember the fact, exact cutoff in the short note. I have got around 3 out of 5 in my short notes. What I'm going to do? So level 2, I'm going to create a mnemonics. I'm going to test it next day morning. Likewise, every day I'm going to prepare a 2-day drill. So on Jan 7, by Jan 7, I should be completely, my target has to be out of 5 I need to get. For that, what I'm going to do? Plan this. Same way, weak essay. What is weak essay? In gynecology, some essay is weaker. Or then you're going to have GIT surgery, some weakness is there. Likewise, focus it down. Likewise, write it down. Fill this template tonight. Don't keep it in your head. Only if you write, only if you keep a deadline, you will be able to understand it. So before I close today's session, I want you to remember 5 non-negotiable rules. So if you are my student, if you are my junior, you need to follow this 5 non-negotiable, okay, non-negotiable rules you are going to follow. What are those 5 non-negotiable rules? Rule 1, identify weakness early. Identify weakness early. Write it down along with me. Identify weakness early. So not late. Don't wait till February. Then discover you're weak in the psychiatry. That is no use. Take diagnostic test. Hereafter, I will be like sharing you mock exams, subject wise, paper wise, topic wise. You have covered medicine, obs, gyne, surgery by mid of January. Take a mock. If you have added pediatric psychiatry by the end of second week of January, take another mock. Early identification is equal to time to fix. If you are able to early identify, then you have more time to fix yourself. Then rule 2, fix the conceptual blocks immediately. If somewhere you are still not understanding a concept, conceptual block is there, fix it. Okay, because you will understand shock later when you are keeping. When I'm less tired, I will read shock. If you're going to keep like that, the day you discover a conceptual block, spend 30 minutes and read it. If not, it is going to get worsen with time. It will never get better. As the time progresses, your panic increases and you will never understand it later. And then third one, don't over-invest. Okay, don't over-invest in topic you are already strong in strong areas. Okay, sometimes we have this tendency. Already, whatever we have read again and again, we will be reading. If you score 90% in a A category, maintain with just 2 minutes drill every day. Invest your time in the places where you feel you are weak. Apply 80-20 principle here. Apply 80-20 principle here. And fourth, distinguish between not studied versus weak. Not studied and weak is entirely different from each other. You haven't covered a topic yet. That is normal. No damage control is needed. Just follow RRR timetable and complete it. If you have studied it and performance is low, then only today's topic, damage control is needed. Many students panic about the topics which they haven't read. That is not weakness. You haven't read yet. For example, psychiatry, dermatology, radiology, and your orthopedics is kept at the end. ENT and ophthalmology I have kept at the end. Still, you haven't touched it. That doesn't mean that. Okay, that doesn't mean that you are weak in that. You have not touched. That's all. If you have completed medicine, even then you are not feeling confident, then that is the place where you are feeling weak. That is your weak one. Okay, then finally, the fifth one is document. Okay, document your damage control. Document your damage control. Okay, keep a weak area log. Today is December 28th. I have shock is my weak area. Level of weakness is 1. How I am going to fix it? And what is the status? Whether I have progressed, whether I have completed, or still I am in progress. Write it down. Review this weekly. So what you're going to do? You're going to review this weekly. Check off whether you have completed the fixes. And by the end of the first revision, you should see the progress in most of the item. Okay, now you have a system for failure also. Last time I have told about the system of success. Now you have a system for failure. Here is the truth nobody tells you. Everyone has weak area. Toppers just fix them faster. Those who are failed doesn't fix them. That's all. Toppers doesn't born prodigy. They are not child prodigy, isn't it? They are also like same like you guys. But what they do is they understand the weak areas. So in the next 1 week, what you're going to do, take the mock exam if you have already not done it. Revise with your previous year question paper. Identify your level weakness. Apply specific fixation for each level. Document your weak areas log. Retest after 1 week. By the end of mid of January, when you walk into the questions, when you go into the next stage of revision, that is refine, phase 2, there will be no weak areas left. Even if there are, you will have a recovery plan. You know where exactly you are lagging and how exactly you need to focus. You won't be examining, you won't be hoping that exam is easier. You will be ready for any paper. Even if it's a tough paper, you will be ready. Okay, you will be ready. Okay, so that's exactly what we are going to do. And in the next session, what you're going to do in the last 2 months of your exam on how to increase your performance plan. That's what I'm going to talk in the next session. Until then, what you need to do is identify your weak areas with honesty, fix them with strategy. Your future patience depends on you. Okay, you now have a system for failure. When you fail, you don't panic. You know the structure. You can fix it and you can overcome that failure to achieve success. That's exactly what I want to tell you. Guys, just imagine I had a 24-hour duty yesterday. Yesterday night, I haven't completely slept. Even then, at 2 o'clock, when I tell 2 o'clock to you guys, I am keeping up my word. I have appeared in the system, in the YouTube exactly at 2 o'clock, and I'm discussing with you guys. I am still feeling sleepy. Even then, I shouldn't be the reason for your failure. If I have that inner conscience and I am coming front of you to discuss, to give some motivation to you, then you should do more motivation. You should do more. You should motivate yourself more to achieve success. Sir, please do important question how to write an exam answer in a structured manner. Bro, just go back, see the session 3. I think today is session 4, isn't it? Today is session 4. In a session 5. Today, what I am doing is a session 5. That means in the session 4, I have discussed already. In the session 4, I have discussed already how to write a structured essay and short note. I am adding bad student. Please tell how to pass in all 4 subjects. Bro, kindly go through. Okay, all my dear juniors, kindly go through from video 1 to video 5. Today, maybe you are attending the 5th session directly. In the first session, I have told you how to strategy, how to pass your exam. And in session 2, I have told how to go into how to identify the areas where you need to concentrate. In session 3, I have talked about the management of fear, anxiety, and burnout. Session 4, I have told how to structure your essay short notes, how to write in your exam, how to think like the examiner. And today I have talked about what are the failures, places where you have, and what are the weak places where you have, and how to achieve success. This is what I have discussed today. Clear. So I have already discussed in the last 5 videos. I want you guys to go through those 5 videos. You will definitely know how to answer the short notes and essay. Okay, God of War. Kindly go through the session 4. If you have any doubts, always welcome. Always you can contact this number. I think many of you are already doing it. Contact this number. I will send voice note. Okay, so some days I studied well. Yesterday I didn't feel the interest of studying. Yes, of course, that's what I told you already. If you don't feel interest to study also, try to complete at least something. Something. Try to take a glance. Walk for 20 minutes outside. Speak with your friends. Come back with some energy and at least complete the must to know topic. Must to know topic. Even if you're not able to fulfill the entire must to know topics, don't worry. You have phase 2 revision where you can complete the gap. But don't lose your energy. At least do one essay per day. At least do two essay per day. How many essays you do, that is going to add up into your brain, into your library of your memory, library of your knowledge. So even if you don't have interest, try to complete at least one essay that day. And when you are feeling low, when you are not able to concentrate, close all the books. Start with your revising your previous topic. 20 minutes. Take or essay on first day, whatever you have read. Try to recall and see. If you are able to recall, very good. If you are not able to recall, see the skeletal structure, whatever you have prepared for heart failure, introduction, etiology, pathogenesis, clinical feature, lab investigation, treatment. So just go through that. That will help you to regain an interest and come back. And always don't sit with your books. Take 20 minutes gap. This also I have told you in the last session. Take minimum 20 minutes gap after you complete 1 hour. Okay, first initially start with 20 minutes, then 5 minutes break. Then go for 30 minutes and then go for 5 minutes break. Then 1 hour, then take 20 minutes break. I've told you all these things. Okay, so that will help you to just give you a space. Okay, sir, some topics maximum time. Can you say notes for reading as easier 15 mark taking maximum time? See, I told you already. When you have a essay, try to don't read from page to page. From A to Z, don't try to read. For example, this also I have told in the last session. No problem. I will again repeat it for the benefit of the people, those who are attending today. See, when you have a essay, art failure, let me tell you art failure. So when you have a essay art failure, what you are exactly going to do is, you're not going to read it from the page A to page Z. You're not going to read from page A to page Z. What you are going to do in this is, you are going to basically, okay, you are going to basically, for example, if it is an art failure, you're going to start with